If only the troglodytes who made these COVID-19 projections, and I think these projections were more political than scientific, if they were half as good as Jimmy the Greek at predicting, people may actually trust them, but let's go through this real quickly. See the links below the video, in the video description, of course. Uppsala University in Sweden predicted 90,000 deaths in a month due to COVID-19 without strict quarantine. The country actually suffered around 3,500 deaths at the time I wrote that. And I wrote a note, see pages 14 through 17 and 29 for a detailed discussion of their predictions. They say, quote, this individual-based modeling project predicts that with the current mitigation approach in Sweden, approximately 96,000 deaths can be expected before July 1st, 2020. And it had the 95% confidence interval was 52,000 on the low end and 183,000 on the high end. And even their low-end prediction was off by almost 10 times. This modeling suffered from the same shortcomings a lot of other models, which I have documented at the links in the video description. The same shortcomings a lot of the other models suffered from, like the Imperial College model. They assume that unless the kingmakers in government, the folks who are made of a finer clay than those regular rank-and-file Swedes, without guidance and overlord behavior from mother, Swedish folks are going to be dropping dead left and right. Sweden is going to be a veritable graveyard. Apparently Swedes are capable of taking care of themselves even if they don't have an Andrew Cuomo-style East German lockdown where parks are closed. Parks are closed. Outside, parks are closed though, it's dangerous. Businesses are shuttered, but you can march for Black Lives Matter because fatherless children and violence in the hood. As of July 1st, 2020, remember, confidence interval of 95%, 52,000 to 183,000 deaths. When the confidence interval from the low end to the high end is that ridiculously large, I'm skeptical. Don't make predictions then. As of July 1st, 2020, Sweden had a grand total of 5,333 deaths. Their low end was almost 10 times too large, which is 52.271 deaths per 100,000, a much better outlook. 52.271 deaths per 100,000. A much better outlook than the 8 jurisdictions up in the northeastern U.S., New York, New Jersey, Rhode Island, Connecticut, Washington, D.C., Massachusetts, Maryland, and Delaware, some of which locked down for a few months. And the Swedes didn't lock down, so there's less people becoming manic and crazy alcoholics while they're locked up in their small apartments. But there's plenty of people in New York City that are going that way, and probably how many of them are sinking into a deep depression and alcoholism while the Swedes aren't. And there's still per 100,000 more dead bodies in New York. I guess Swedish citizens are better at staying clean and washing their hands than uppity progressives in New York City or New York State who are still avoiding the subway like the plague, and for good reason. As I showed in my article on social distancing, Swedish citizens did curtail their movements quite a bit from mid-March to mid-April, sans mother telling them what to do. Lastly, the IHME, or Institute for Health Metrics and Evaluation, which has its projections autistically repeated by virtually everyone looking to say, quote, if you don't lock down in your basement like half of Baltimore is all the time because they have no job, no income, no assets, if you don't lock down, then your state or country is going to be a veritable cemetery, end quote. On May the 3rd, the brilliant IHME, the smartest government provocateurs, I mean the smartest folks in the room, predicted that Sweden could have up to 2,800 daily deaths. There was a lot of uncertainty in their graph, and they did it for a reason, to scare everyone. I have a projection between 1,000 and 2,000 folks in New York City will die from COVID-19 in the next 2 days. Derp. These were not complicated long-term projections. They were predicting what would happen in the next 2 weeks based on months of data. Yet their daily death peak was 75% lower than the baseline prediction and 96% lower than the worst case prediction. In other words, it was total BS. But folks who want to use this virus as a springboard for more government control will repeat this like politicians looking to redistribute trillions of dollars, because if we don't do it, you're all going to die and the economy is going to collapse. As of June 30th, 89% of Sweden's COVID-19 deaths are citizens 70 years of age and older. We aren't seeing droves of healthy 20, 30, 40, and 50-somethings drop dead. Now, if they're a 50-something that's a heroin addict, that's a different story. Or like that one guy out in California named Dave with no teeth that I've refuted many times. As I wrote in my articles, protect the elderly and those with immunodeficiencies. As I also wrote, there are a lot of communities in America where a lot of folks are walking around in a drug-induced fog. No wonder those communities are being ravaged by COVID-19. COVID-19 is targeting drug addicts on purpose. Don't you know? Have a nice day. Don't thank me now, and don't take the projections seriously. Protect yourself. Well, if you're a progressive in New York City, you probably need somebody to tell you what to do. And in that case, I can't help you. Goodbye.